Bloom syndrome is a condition that causes low height and a skin rash when exposed to sunlight. Symptoms include being smaller than the average person in terms of height and weight, sun-induced redness on the nose and cheeks, areas of skin that are lighter or darker in color, a higher risk of cancer, a high-pitched voice, unusual facial characteristics, and learning problems. Bloom syndrome is a rare condition that affects just a few hundred people, with roughly 1/3 of those affected being of Central and Eastern European Jewish descent. Bloom syndrome is diagnosed by a laboratory test known as a chromosome study. Amniocentesis can be used to diagnose Bloom syndrome during pregnancy, and in the near future, DNA analysis will be available.
Bloom syndrome is caused by a mutation in the BLM gene located on chromosome 15. A BLM ASH mutation occurs. It removes 6 nucleotides and replaces them with 7 nucleotides. This mutation affects the helicase protein, whose function is to bind the DNA and unwind the strands. The protein becomes shorter as a result of the mutation.
This disease is inherited from 2 parents through an autosomal recessive condition in which each parent has one copy of the mutated gene recessive pattern. This is related to meiosis since the BLM protein that is defective in Bloom syndrome patients is a RECQ helicase. Helicases aid in the replication of DNA.
Patients with Bloom syndrome are expected to live, on average, about 26 years. Bloom syndrome has no cure. However, there is treatment you may use to avoid sun exposure.